Hair transplant, the most happening hair restoration processes that we know currently. What are the various techniques that we do a hair transplant with? If you want to know further on this, please see this entire video. I'm Dr. Deepthi, Consultant Plastic Surgeon, Eternelle Aesthetics. In the initial days, hair transplant was solely done with one technique called FUT. In this method, we extract a complete strip of hair from the donor side, that is wherever there is healthy hair present, and then we extract each follicle from that extracted strip. In this process, there is a suture line that appears at the extraction site, which is used to close the wound, and then from the strip of hair that we have removed, we extract each hair follicle, which is later used for the implantation. In this process, hair trimming is done at the donor site, and if the hair is really long in terms of the donor area, we generally also do trim the entire head. FUE is the most current technique widely followed in most of the places. In this process, we don't actually remove an entire hair strip. We punch out through each hair follicle with the help of a micromotor or a punch, wherein we extract each follicle. The size of the punch and other things depend upon the implantation site and vary upon what reason are we performing the extraction for. In this process, it's better if we trim the hair over the donor area. These follicles are further stored in normal saline and we go for implantation. And then what comes is DHI, Direct Hair Implantation. Actually, DHI is a technique which is used mostly for implantation and it is not a type of extraction. So whether you perform a FUT or a FUE, and most widely it is FUE only, the process of implantation, the depth of implantation of the follicle depends upon the type of the technique that we pick, and one of them is DHE. In DHE, the damage to the follicle is minimized with the depth of the implantation being very much in control within the surgeon's hand. And coming to the differences between FUT and FUE, it depends upon the choice of the surgeon to pick what procedure is suitable for a person. In FUE, we are very well privileged to pick up very strong and thick hair follicles, and these can be used to fill up the main area of the balding. Whereas in FUT, since the whole entire strip is taken out while the extraction process, we can even segregate very fine hair follicles. So when we are creating a designer hairline or even for filling a process in between the thick follicles, the follicles that are extracted from FUT, that is the fine hair follicles, will help us to build the volume and give a very nice designer hairline. Whether it's FUT or FUE or any of the implantation techniques that we followed, that is DHI, the ultimate take of the graft depends upon the patient's post-care and the patient's lifestyle changes that he has done over the course of the time. Good hydration, no smoking, no alcohol, and good sleep help in better take of the graft because the blood supply to the graft is well directed with these lifestyle changes. Further information for the procedures suitable to you and to know more about the techniques followed, please comment in the comment box below. If you feel this information is useful to you and for all the people who's losing their hair and leading towards balding, please share this video and it will be helpful to them. And please like and subscribe our channel for further videos.